This is a psychiatrist who's about to change the world. Now, you've probably never heard of her, but they're going to be teaching her work in colleges and universities for the next 200 years. And when you learn what I'm about to show you that she's figuring out, it might just change your life. The blood vessels in your brain have a blood-brain barrier. That is a barrier that keeps toxins from crossing from your blood vessels to your brain. The NIH says the blood-brain barrier is a diffusion barrier, which impedes influx of most compounds from blood to brain. We also know that blood-brain barrier leakage can be tied to Alzheimer's, Parkinson's, and bipolar disorder, along with a lot of other stuff. And bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. Dr. Culkin and her colleagues did a study. Insulin resistance and blood-brain barrier dysfunction underlie neuroprogression in bipolar disorder. And they write, our finding that all bipolar disorder patients with extensive blood-brain barrier leakage also had insulin resistance highlights a potential causal link between insulin resistance and blood-brain barrier dysfunction. And they didn't stop there. They did another study, treating insulin resistance with metformin as a strategy to improve clinical outcomes in treatment-resistant bipolar depression. They wanted to use metformin, which is a type 2 diabetic drug, to treat bipolar depression. And they concluded, pending replication, this early study suggests that reversal of insulin resistance by metformin offers a path out of treatment-resistant bipolar depression. Now, what they believe is that your metabolic health, insulin resistance, prediabetes, type 2 diabetes, has a big impact on your mental health. And that's interesting.